My name is Mary Lloyd Ireland. I'm an orthopedic surgeon, full professor at the University of Kentucky. This presentation is based on advocacy. Our athletes entrust us to take care of them at many levels. As orthopedists, sports medicine physicians, we need to address some of the problems that our athletes encounter that are difficult ones. That is abuse by coaches, other physicians, and how can we be better advocates for our athletes? It's not by turning a blind eye, it's to understand how we can be better advocates for our athletes and report any suspicious behavior and communicate. How can we be better advocates for our athletes? First of all, when you do a Google search, 97 million results on how can physicians be better advocates. Advocacy for student athletes, 5.1 million. A lot of things about advocacy, but do we really know and understand what advocacy is and how we can protect our athletes? What is the definition of physician advocacy? The Canadian article, the role as an advocate is integral to competency in Canada. Definition, action by a physician to promote those social, economic, educational, and political changes that ameliorate the suffering and threats to human health and well-being that he or she identifies through his or her professional work and expertise. Always start with a definition. As a noun, an advocate really stands for what team physicians, sports physicians, orthopedists are. A person who publicly supports or recommends a particular cause or policy. Champion, supporter, backer, promoter, proponent, protector, patron, booster. As a verb, to support or argue for, to plead in favor of. The synonyms are prescribe, recommend, comment, advise, support, back, uphold, urge, promote, endorse, sanction. Again, we do all these things. The American Academy of Orthopaedic Surgeons advocacy page, also a lot of results on advocacy, almost 2,000 results if we go to that page and search for advocacy. A lot of different ways we can be advocates. Residents in Advocacy, Advocacy Action Center, Advocacy for Change, sign up for donations, supporting the PAC, and other things. Advocacy on the Hill, AAOS, led by the Committee of Legislative and Regulatory Advocacy, works government relations to identify priorities. Alan Anderson, then president of AAOS, testified on the Hill, and with his leadership and support of our PAC and AAOS, passed the Sports Medicine Clarity Act, improves care for all athletes. So we were proud as a society to be a part of this process to cross the finish line with passage of the Sports Medicine Licensure Clarity Act, which was signed into law. This legislation provides legal protection for traveling team physicians and safeguard injured athletes' timely access to healthcare professionals who know and understand their medical history best. It was going to be very difficult without passage of this to take care of our athletes as we travel across state lines. We, as orthopedists, sports medicine physicians, should get involved from the local level to Capitol Hill. This is a picture of Dr. Anderson as he testified before Congress, and the result was this passage of the Sports Medicine Clarity Act. Dr. Anderson was the consummate advocate. In 2006, in his presidential address, Richard Kyle talked about unity. We must unite with one voice and communicate our efforts clearly to our members, our patients, and the public. Seth Leopold talked about orthopedics, advocacy, action. Are vulnerable young athletes harmed by sports? If they are, as humanitarians, we need to be vocal first responders and advocate for different training regimens. Specialization, youth sports, still a problem, causing injuries, overuse, and acute injuries. Be an advocate, protect young athletes. The Stop Sports Injury Program, which was supported by numerous organizations and spearheaded by one of my mentors, James Andrews, when he was president of AAOS. There are about 20 sports and they go through different injury patterns. The student athlete can go to this site and maybe make their diagnosis and have their parents take them to the doctor. It's kind of like a stop smoking site. Let's make early diagnosis and work on injury prevention of these youth athletes, whether it's baseball, softball, and help them stay in the game and be safe. This 14-year-old pitcher was not so lucky. Not yet skeletally mature. He had an ulnar collateral ligament injury, had reconstruction. His baseball career ended. Can we prevent all of these injuries? No, but we can prevent some of them. It must be our charge to be the advocate for our young student athletes. What about this quote? This was an article in the New York Times. An elite soccer athlete, age 15, had multiple ACL injuries, both knees. Her mindset after surgeries was rehab hard, get back on the field, compete fiercely, hope not to be re-injured. If it is the hope not to be re-injured, or if there is fear of injury, kinesiophobia, they will get injured sooner, unfortunately, than later. So we should make sure that our athletes are prepared physically and psychologically to go back on the field. We oftentimes need to be the parent in a situation where we're not concerned about that scholarship or how quickly they get back for that showcase. We must protect these young athletes from re-injuring themselves. They don't understand what it will be like 10, 20 years later when they have an arthritic knee. As the flag warnings at the beach, get them out of the water. Pay attention. Report. Confront the parents about when an athlete should be back on the field. And even more importantly, if there is any suggestion of abuse by a coach, parent, another athlete, teacher, physician, pay attention, report, and confront, and document this and report it. I was at the 1992 Olympics where Kim Zmeskal performed. She actually medaled. She was fighting through recovery from stress fractures, and she really felt she was a failure. However, she was a medalist. That's Bella Carolla, her coach. What did we miss during the gymnastics? Ray Nasser being the team physician. How did it go on so long? We must educate coaches and parents. Safe Sport is a site to go to and also take the test. This is required of anybody taking care of Olympic athletes, and it should also be required of physicians taking care of college and high school. There are scenarios about abuse and whether you should be concerned that a coach, parent, physician, anybody involved with youth sports are abusing that athlete. United Educators, this is another site that to be able to do some studies and take care of our athletes at our university, we have to take this course. And again, it's an online course, identifying and reporting sexual misconduct, hiring staff who work with minors, shine a light. And this is another site and test that I think you should take. Be aware of these tests. Other organizations such as NATA are developing these tests as well. U.S. Center for SafeSport.org. So mandatory reporting, sexual misconduct, awareness education, emotional and physical misconduct. These are all areas that need to be reported. We want our athletes safe and supported. Take the test. If you work with young athletes, you got to protect them and yourself. I've had the opportunity to start a Girls Can program through the College of Health Sciences at the University of Kentucky. It's called the Active Women's Health Initiative, and we support girls, getting them to know that they can do sports, be active, but also they can speak up and report things and say things to those that need to hear it. Congress passed a bill in February of 2018, became public law, to prevent the sexual abuse of minors and amateur athletes by requiring the prompt reporting of sexual abuse to law enforcement authorities and for other purposes. This is the law. You must know who to report to, whether it's through your university, school system, the organizations that you're taking care of these teams, state, high school associations. Know who to report to and confront individuals if suspected abuse occurs. Larry Nassar, convicted of sexual abuse of 265 women, probably a lot more. When you do a Google search, 64 million hits. And this is a poignant quote. 2 letters in front of their names and a potential trail of hundreds of victims. Dr., MD. The student athletes have implicit trust that my doctor will do no harm. Team doctors convicted of abuse, Dr. Robert Anderson and Richard Strauss, after they had died. The abuse was to male victims at University of Michigan by Dr. Anderson and Ohio State University by Dr. Strauss. And Larry Nassar at Michigan State, and he was the doctor for USA Gymnastics for many years. Nobody knew, nobody reported this really over the course of 20 years. At AAOSSM annual meeting in 2019, there was a well-attended event with one of the abused athletes by Larry Nassar. His name never came up in that interview, but it was a very good interview with Madison Koshin, who was an Olympian and UCLA gymnast, done by Dr. Indelicato and Hannafin. I would recommend listening to that. As an elite gymnast, these young girls didn't think about reporting or saying anything because they thought it was part of the package, and they would disappoint their parents, peers, if they were thrown out of the training center where they were. So they didn't speak up. We are advocates at all levels, and we should keep the student athletes' health, well-being, both mental and physical, in the highest regards. They trust us, and we have to report these abusive situations. Recently, gymnastic stars Simone Biles, Michaela Maroney, Maggie Nichols, and Allie Raisman testified before Congress. The FBI knew of the allegations against Larry Nassar in 2016, and they did not act on it. These athletes are very upset, rightly so, and he and this sexual abuse has changed their lives forever. We must act. The FBI didn't, but we as physicians and others dealing with student athletes must report. Don't turn away, no blind eye. You must report. If you're not sure who to report to, find out and report. If you think about abuse, it's better to report it. Will new Olympic abuse prevention policy make athletes safer? This was an NPR, the link is here, a report with Megan Chakrabarty. Was really a great listen. These were the people on the panel who actually, one was a sexual victim attorney, the vice president of the public policy at U.S. Center for Safe Sport, and the one in the middle was a gold medalist Olympic swimmer whose father is an orthopedist, and she is an advocate and author of Equal Play, Title IX, and Social Change. So I think it's good to listen to these. The Forum, which is an organization of female orthopedic surgeons, came up with a suggestion that was published in AAOS Now. This was headed up by Marlene DeMayo, Tammy Scarpella, Karen Sutton, Michelle Wolcott, coordinating statement with the Ruth Jackson Orthopedic Society. And this is about sexual abuse, creating a safe environment for competitive athletes. This was endorsed by our academy, and we should place these in training rooms, provide a safe haven for athletes who are discriminatory behavior and sexual abuse, harassment are not tolerated. where athletes' confidentiality is respected. We have to create an environment where the athlete will say something, and once reported to the physician must act. So by definition, the sports medicine practitioner should recognize potential sexual abuse, harassment, and provide an immediate and appropriate response. The forum also published this position statement in that same AAOS Now. Suspected or alleged sexual abuse, harassment should be clearly posted in every athletic training room. Annual education should be mandated for all parties, may be included with existing programs, but must be specific to the athlete. Our role as an advocate, be involved on multiple levels, from musculoskeletal, mental, funding, law change, be involved with AAOS, other societies. Use your sixth sense if something is not right. We all have this sixth sense of how injured an athlete is. Through the athletic trainers, they have that sixth sense. So use this, and if something is not right, explore it, protect the athlete. Present the game plan, treatment, and return to play. Abuse occurs on multiple levels. If you think it, report it. William Osler, Canadian. The good physician treats the disease. The great physician treats the patient who has the disease. The practice of medicine is an art, not a trade, a calling, not a business, a calling in which your heart will be exercised equally with your head. Often the best part of your work will have nothing to do with potions and powders or surgeries, but with the exercise of an influence of the strong upon the weak, of the righteous upon the wicked, of the wise upon the foolish. William Osler, 1849, 1919. Wise words, still true today. Over a century ago, he said this. Michelle Wee was ready to retire, but then she got mad. She was playing in a scramble. Giuliani recalled how Rush Limbaugh had been perturbed by the photographers trailing them in a 2014 Pro-Am in which they were grouped with Wee West. Giuliani said that gorgeous Wee West putting stance was attracting the photographers who, he said, were trying to take pictures of her panties. Not acceptable, now or any time. If some of this abusive verbal behavior occurs, this also should be reported. Did I miss some of these abused athletes in Barcelona? I worked with them during the Olympic Games. I felt nothing was unusual. They were highly competitive, fought through hardships of injury, and were there to reach the pinnacle of their career. Did I miss something? Obviously, many of these individuals were abused, but they weren't ready to talk about it at that point, and I didn't even think about it. So confront, report, don't walk away, pay attention to the warning signs. In clinics in sports medicine, I was asked to write one of the hardest chapters I ever have written, Balancing Life as a Team Physician. Number 1, do the right thing, always no exception, and this includes doing the right thing for detecting any abuse and for being an advocate for your peers, for your athletes. Be an advocate. Don't let them go back on the field too quickly. If you suspect any abusive behavior by anybody who is associated with them, adults, report it. It is better to be an advocate than curse your competition. Don't demand respect from players and coaches, earn it. Loyalty is the weakest of human values. Don't expect your team to always be loyal to you. If you speak up and say something that you feel needs to be said, you might lose that team, but there'll be other teams and you must do the right thing. Communicate. Team physicians must always be available to the athletic training staff. You need to communicate to athletes, to coaches, to parents if there's an injury. My high school motto in the yearbook was, in order to hit the mark, one must aim a little higher. So I think we all should aim higher. Number 7, enjoy your role as a team physician. It is a privilege for us to be able to take care of these athletes. Have fun. Remember the 5 A's, not just 3: availability, ability, affability, advocacy, and affiliation. Dare to care, and finally, don't forget your family and friends. Again, I'm so passionate about this program, Girls Can. We need to make sure that girls can do so many things, make sure we can empower them to be better leaders, have better fitness, wellness, nutrition, and learn that they can be athletes and active for life. Our goal is to enhance physical activity, health, and wellness of these young girls, and we are achieving this goal by providing young girls exposure to sports and physical activity, health-related educational activities, opportunities to engage with active female role models. Here are the links. We've come a long way in sports medicine with higher numbers of females. In the early 90s, this was taken in Seattle at the AAOS annual meeting. There were 6 female orthopedic surgeons. We grew by 2014, and we've grown even more by 2021 in Nashville. You go, girl. Thank you for your time.